So first off, I just want to thank you all for making it to this point and watching this video presentation. So this presentation is Squat School, and it's a sequence of exercise progressions to get everyone safely into a full range of motion squat, and then we'll provide evidence on why you should, by Cole Hyde and Alex Myers. So we want to start off with 3 key takeaways that we want you to get out of this presentation. And that's, again, a sequence of exercise progressions to get everyone working towards safely getting into a full range of motion squat, and then we'll provide evidence of why you should. So the 3 key takeaways that we want you to understand by the end is, number 1, why full range of motion squatting is a good thing. Number 2, how to use the 4 exercise sequence to get into a full range of motion squat. And then number 3, why you should be doing this for yourself as well as for your patients. I thought that this would be a beneficial slide to go over, and that's real world examples of deep squatting. So to start off, all of us as kids are able to effortlessly drop down into this deep squat. We believe it's a foundational human movement, and these kids, they sit in this bottom position for extended periods of time, and they don't have knee issues, they don't have back issues as a result. We just lose this ability as we get older because of modern chairs, not using this full range of motion during exercise, and not resting in this position like some cultures do, as you can see on the 2 pictures on the right. In some cultures, it's a very common way to eat or even just rest. And in addition to that, again, Olympic weightlifters, they're in this very deep squat position with heavy loads very, very often, and they don't have these traumatic knee injuries. An interesting note is that with the Olympic weightlifters, they don't suffer knee injuries more than the average person. It's just the knee injuries that they do have are actually just overuse injuries and tendinopathy issues, which is just a load management issue. And according to a study, the injuries typical of elite weightlifters are primarily overuse injuries, not traumatic injuries compromising joint integrity. These injury patterns and rates are similar to those reported for other sports and activities. So these Olympic weightlifters use a progressive weightlifting approach, which gradually exposes their tissues to new loads and allows them to recover properly, which is what we will go over in the exercise sequence that we are providing. The end goal for the 4 exercise progression that we are providing is a full range of motion squat, and this can be either a front squat, pictured with the Olympic weightlifter in the top left, a goblet squat with a dumbbell or kettlebell out in front, as you can see in the top right picture, or even a full range of motion back squat in the bottom picture. And so squatting, which is a fundamental human movement pattern, is often regarded as a beneficial exercise for overall lower body strength and stability. However, engaging in squatting with a full range of motion holds even more advantages for the knees specifically. So research studies have consistently shown that deep squats, where the hips descend below parallel and you achieve a full knee flexion, promotes increased activation and strengthening of the muscles surrounding the knee joint, such as the quadriceps and the hamstrings. And this was shown in a study by Escamilla in 2001 titled Knee Biomechanics of the Dynamic Squat Exercise. Additionally, in a study done by Hartman et al. In 2013, titled Analysis of the Load on the Knee Joint and Vertebral Column with Changes in Squatting Depth and Weight Load, found that squatting through a full range of motion improves muscle balance around the knee, reducing the risk of imbalances and potential knee injuries. Furthermore, a study investigated the effects of squatting depth on vertical jump performance. It found that individuals who performed deep squats with a knee angle deeper than 90 degrees showed superior jump performance compared to those who squatted to a 1/4 depth. And this was done by Hartman et al. In 2021 in a study titled Influence of Squatting Depth on Jumping Performance. So in light of all these findings, squatting with a full range of motion is valuable for promoting knee health, performance, and resilience. And we are providing a sequence of exercise progressions to get everyone safely into a full range of motion squat. So the full range of motion squat can be either a back squat, front squat, goblet squat, or a bodyweight squat. Somebody can elevate the heels with a wedge, a small plate, weightlifting shoes, or even a slant board, as you can see in the picture on the top right. The main goal is simply to get everyone safely into a full knee bend so they can experience these benefits. And we want to get a full knee flexion where the hamstrings are in contact with the calf, ideally with progressive loads. So the full knee bend squat is a safe and effective exercise that can safely load the knee joint to improve pain-free ability. And again, in this study mentioned earlier by Hartman et al. In 2013, provided that technique is learned accurately under expert supervision and with progressive training loads, the deep squat presents an effective training exercise for protection against injuries and strengthening of the lower extremity. Contrary to commonly voiced concern, deep squats do not contribute increased risk of injury to passive tissues. So we obviously love that quote in supporting the benefits of the deep squat. And the idea that a bad movement exists should be challenged. Rather, some individuals may be unprepared for some movements, which could lead to injury and performance deficits. When there's strength and mobility in a position, the tissues are better prepared for whenever that movement or position is encountered, whether in sports or just in everyday life, and thus results in less chance of injury. So rather than avoiding certain positions, it is best to take a graded approach using a sequence of progressions to confront that position and build resilience over time. So here is the 4 exercise progression to get into a full range of motion squat. And we just want to introduce these 4 exercises quickly before we go over them in depth later in the presentation. So the first exercise is the reverse sled pull. After that, we have the reverse step up. After that, we have the full range of motion split squat. And then finally, we have the full range of motion squat. Why full range of motion squatting? So to start off, this quote in a study by Bloomquist et al. 2013 titled Effective Range of Motion in Heavy Load Squatting on Muscle and Tendon Adaptations. They stated training deep squats elicited favorable adaptations on knee extensor muscle size and function compared to training shallow squats. And again, this just further shows the benefits of using that joint's full range of motion. In addition to that, full range of motion squatting provides pressure and movement to bring synovial fluid and healing to the knee joint. And this was done in a study by Schmidt et al. In 2007 titled Boundary Lubrication of Cartilage, Role of Synovial Fluid Constituents. And this just shows that the connective tissue can heal in the knee in response to synovial fluid, which requires that pressure and motion of a full range of motion, again, to kind of heal that knee joint. And further, there is increased tension and compression with a full range of motion squat, and this results in tendon thickening. And this was shown in a study by Yang et al. In 2004 titled Proliferation and Collagen Production of Human Patellar Tendon Fibroblasts in Response to Cyclic Uniaxial Stretching in Serum-Free Conditions. And finally, full range of motion squats have shown increased ACL and PCL thickness. And this was shown by a study by Gerzilak et al. In 2012 titled Hypertrophied Cruciate Ligament in High Performance Weightlifters Observed in Magnetic Resonance Imaging. And so deep squatting has previously been thought of to be actually harmful for the ACL and PCL because early research suggested that allowing your knees to travel over your toes during a squat caused excessive strain and stress on these ligaments. However, as we just stated, the further research has shown that this is not true and that deep squats actually may be protective for the knees. And so athletes who regularly perform deep squats have demonstrated increased ACL and PCL thickness. And just as an added bonus, moderate loading of knee cartilage has been shown to elicit improvements in cartilage volume. Full depth squats and the VMO muscle. So I thought this would be an interesting topic to at least bring up. And there's definitely much debate taking place regarding the topic of selective strengthening of the different components of the quadriceps muscle. So the prevailing argument is that this cannot be done and that strengthening one part of the quad strengthens all parts of the quad. However, there is some research showing the opposite, and I would like to at least bring that up. And before I do that, I just want to, kind of as an anecdotal example, I would like to show the Olympic weightlifter. On the top left picture is Liu Xiaojun, and he is known for his abnormally large VMO muscle, and I think that that's just interesting because he is also known for how deep he squats. And in addition to that, we have the top right bodybuilder, Tom Platz, and he has been a lifelong proponent of the full range of motion deep squat, and he was also known for his very large VMO muscle and overall legs in general. And also an interesting point with him, he is still doing a full range of motion deep loaded squat at around 65 years old, and his knees are pretty healthy after doing this his whole life. So, getting back to the research, recent research appears to suggest that interesting things happen to the quads the deeper you squat. So on the bottom of a full range of motion squat with about 140 degrees of knee bend, the VMO is activated to a proportionally higher degree than the vastus lateralis. And this was proven by Marchetti et al. In 2016 in a study titled Muscle Activation Differs Between 3 Different Knee Joint Angle Positions During a Maximal Isometric Back Squat Exercise. So I just thought that was an interesting study to at least bring up. Tendinopathy and hyaline cartilage. So this diagram shows tendinopathy perfectly. So tendons need load, not too much load to where the tendon can't withstand it, and not too little load to where the tendon starts to atrophy and weaken. Both too much load and too little load result in reactive tendinopathy, tendon disrepair, and degenerative tendinopathy. However, when you find that sweet spot and you have an optimized load, a stimulus is imposed on the tendon, which therefore adapts and strengthens. This is where the proper progression of exercise is so essential. It is vitally important to find the right amount of tension and load on the tendon by choosing the proper exercise at the right intensity. And so for tendinopathy, this is mainly guided by pain. This is done by gradually exposing the patient to tendon loading and progressively overloading in a pain-free range, which will result in improvement in the symptoms of tendinopathy over time. So basically, with tendinopathy, we want to find where they're at and gradually, progressively overload to improve their tendon resilience. And again, with our sequence, we're providing a simple and effective exercise progression, which does just that. It progressively overloads the tendon in a pain-free range, always with pain guiding the progression and always keeping the focus on gradually improving your own ability. And squatting with a full range of motion could potentially be an effective exercise to improve tendon health even more due to the positive tensile stress throughout the full tendon range of motion. So by performing full range of motion squats, the quadricep muscles are fully engaged, which helps to strengthen the muscles around the knee joint. This increased strength helps to distribute the load more evenly across the joint, reducing the stress placed on the patellar tendon and allowing for safer tendons in the future. So we also know that eccentric training is very beneficial and is kind of the gold standard for tendinopathy. And this is where also the power of the progression that we're providing, or the sequence that we're providing, in that you can kind of slow the tempo down for each exercise and have more of an eccentric tempo for each one. And that just comes down to kind of the skill of the clinician providing this sequence. And one study that I just wanted to include by Bontemps et al., and that's a short bout of eccentric downhill running training can significantly increase the stiffness of the patellar tendon and strength and size of surrounding musculature, similar to resistance training. So this study further demonstrates that tendons need load and respond favorably to load. So downhill running is a similar stimulus to reverse step-ups. If you were to kind of compare the running downhill versus a reverse step-up, it's a very similar motion and a very similar eccentric contraction. And that's why this reverse step up, which is the second exercise in the 4 exercise sequence, works out very well for tendon health. The length tension curve of the muscle explains the concept of short range and long range very well. So active tension can be thought of as when the tension is on the muscle. Passive tension can be thought of as when the tension is on the connective tissue. A short range exercise is when the majority of the movement utilizes active tension, while a long range exercise is when the majority of the movement uses passive tension. So following this, it can be stated that a short range exercise is more muscle dominant, while a long range exercise is more connective tissue dominant. So this concept applies to every single exercise for every joint of the body. There's no exercise that's 100% short range, and there's no exercise that is 100% long range. Rather, every exercise falls along a continuum of both. So for example, in regards to knee extension, which works the quadricep muscle, a short range exercise where it is muscle dominant would be a reverse step up. So, and that's the photo on the left. This is a short range exercise because the knee is only going through its top range of motion and the quadriceps is not being stretched. So the muscle is basically doing all the work and there's no tension or stress on the connective tissue. Not as much as with, say, a full squat. And again, on the other end of the spectrum, a full range of motion back squat would be considered a long range exercise because it is connective tissue dominant, because the muscle quadriceps is being maximally stretched while under load, which places stress on the connective tissue as well as on the muscle. And that's, as you can see with the photo on the right. So short range movements often feel like the muscle is cramping, while long range movements feel like the muscle is tearing, or like you can feel it really stretching. So it's stretching under load. So put simply, a short range muscle is contracted under load. A long range exercise is where the muscle is being lengthened under load. So another, I guess, a cool example of primarily a short range exercise is pushing and pulling like a sled, because that's strictly concentric movements. It's interesting, there's no eccentric contractions with sleds, so the muscle is basically doing all of the work. And so that's a great exercise to start to warm up with, because the muscles are doing the work, you're bringing tons of healing and blood flow to the area, and that will actually prepare you better for these long range exercises. Full range squatting and meniscus health. So full range motion plays a crucial role in maintaining optimal meniscus health. So the meniscus, a cartilage structure found in the knee joint, acts as a shock absorber and provides stability during movement. Menisci and cartilage, ligaments, and bones are susceptible to anabolic, metabolic processes and functional structural adaptations in response to increased activity and mechanical influences. Menisci require load to heal and strengthen. In addition, it has been found in numerous studies that menisci respond very well to exercise for recovering from a tear. According to this quote, interestingly, exercise therapy was as effective after a 2-year follow-up period and was superior in the short term for thigh muscle strength. The results of the study build on those from the smaller study mentioned earlier. In that study, both groups received instruction for the same graduated exercise plan. The researchers found that exercise was comparable to surgery for meniscal tears in patients with no osteoarthritis. So to add to that, a meta-analysis concluded that there was no statistical difference in clinical outcomes such as relief in knee pain and improved knee function between arthroscopic meniscus knee surgery and conservative management for degenerative meniscal tears. As this research demonstrates, exercise is effective for the health and recovery from meniscus health, from meniscal tears. Full range motion squats are even more effective for the health and recovery of menisci due to the lubrication of synovial fluid from that combination of pressure and motion that we discussed earlier throughout the knee joint that can occur. So a graded approach of reverse sled, reverse step-ups, full range of motion split squats, and full range of motion squats are a perfect approach to begin gradually loading the knee joint and supplying it with the load, motion, and pressure that the connective tissue of the knee joint require. So the first step in the 4 exercise sequence to getting into a full range of motion back squat is backwards walking or backwards sled pulls. And this is the first exercise because this is a short range movement, not a lot of stress and tension on the connective tissue. It's just a lot of concentric movements that are going to begin to bring healing and blood flow to the knee joint. This is high reps, little muscle and tendon ligament damage due to no eccentric contraction. You'll find that if you can use a sled hard and you can go until you get like a 10 out of 10 pump, and you actually won't be sore from this exercise. It basically speeds up the healing, and it's tons of blood flow circulation. So this is the lowest and safest level of knee loading, and that's why it's the first exercise. Like, it's not going to do any damage. It's just going to increase the healing and allow you to get into more difficult exercises, which we will show next. Second exercise in the 4 exercise sequence to get into a full range of motion squat is the reverse step up. And this can either be a Patrick, Poliquin, or Peterson step up. They're all very similar motions on the knee, except the Patrick is just done with a flat foot, Poliquin is heel elevated, and Peterson is heel elevated, but you don't have a wedge or anything under your foot. Like, you're just bouncing on the ball of the foot. So this exercise begins to load the knee tendons and ligaments. It's very good for the patellar tendon. And how you progress this exercise, you want to start in a pain-free range always, and it's good to start with no load and no elevation. So you're just gradually beginning to load that knee joint. After that, you want to progress height until you get to 6 inches. And then once you get to 6 inches and you're doing that in a pain-free range, then you can begin to add load. For the third exercise to get into a full range of motion squat, we have the full range of motion split squat. And this is going to begin to work that full range of motion in the knee, but we're going to do it one side at a time. So this is going to build structural balance between legs. You or your patients might notice that you have a lot of imbalances between sides, and this is going to help even out before you get into that full range of motion squat. This is a great exercise for increasing ankle mobility because you're driving that knee forward over the foot, as well as the back hip flexor mobility because of the deep hip extension that you're getting into. And how you want to progress this exercise, you want to start on a very, very high box or even a chair or something like that in body weight, and you're just gradually working that range of motion. You can even hold on to a wall or a squat rack or something to even assist you and make it actually lighter than body weight. And then the next progression with that would be lowering the box all the way until you get to flat ground. Once you can do that, then you can add load. And if you can do this exercise with load in a pain-free range, then you are ready for the full range of motion back squat. The fourth and final exercise is the full range of motion squat. And again, this can be just a body weight squat, a goblet squat with a dumbbell or kettlebell in front, a back squat, or a front squat. And the whole goal is to basically get both of your legs in that full knee flexion range of motion, and we begin to load that position. And this exercise provides a lot of benefits, which we have gone over throughout this entire presentation. And having the ability to do this exercise with load, pain-free, it's very, very beneficial for your knee health.
Now, I want to go over the mobility aspect and why is it essential to efficiently perform the deep squat. First off, why is it important? Well, with increased mobility, we can actually increase stability and adaptation due to the exercise. This will then lead to a more optimization of increasing strength and muscle size as well. Another reason is to avoid compensation. Sometimes we have weaknesses and restrictions at certain parts of our body at which our muscles will activate unnecessarily to help perform the exercise. This will then lead to an increased risk of injury. And that's where our last reason comes into play, is that we want to decrease the risk of injury. With greater range of motion along the joints, we're able to perform many activities and stay in certain positions without any problematic symptoms. Now when it comes to the deep squat, we need to understand the biomechanics and how to perform it correctly. The deep squat requires a large amount of ankle dorsiflexion, knee flexion, and hip flexion with trunk mobility. We want, as you can see the picture on the right, this is me performing the squat with trunk upright as possible with great amount of dorsiflexion, knee flexion, and hip flexion as well. We also want to make sure that the lumbar spine is neutral while performing the deep squat. When it comes to sex, there are differences between the two when it comes to squat mechanics. Since females have a wider hip structure than males, they may need to widen their foot stance and lean forward more to obtain an optimal squat. The opposite goes for males, where they may need a more upright position due to more mass in the upper body and a narrow stance. One study has shown the differences of squat mechanics between the two, and that hip flexion range of motion was significantly associated with squat depth in male subjects, and ankle dorsiflexion with an extended knee and dorsiflexor strength were associated with squat depth in female subjects. While there are differences between the sex, it is solely based on an individual's preference and structure, since everyone has their own slight, unique body structures. Here are a set of mobility exercises that are quick to perform before starting your usual workout routine. The knee to wall and forward lunge seem very similar, but the knee to wall exercises solely focuses on ankle dorsiflexion strength and range of motion, while the forward lunge focuses more on the hip flexors. The pelvic tilts and the ankle circles both can be done at sitting or standing, but is solely based on your preference. Here's another set of mobility exercises. These sets tend to focus more on hip mobility as we need it to achieve greater squat depth. As you can see, there tends to be a lot of hip internal rotation with these exercises. A study has shown that adequate amount of hip internal rotation can help achieve greater squat depth. The hip circles indicate performing all planes of range of motion, such as hip flexion, external rotation, internal rotation, and extension, which will greatly help overall hip mobility. Overall, these mobility exercises are great to help mobilize the lower extremity and achieve the deep squat without symptomatic problems.
We just want to thank you for making it to the end of this video presentation. Thank you for listening, and we appreciate any insight or questions or responses. If you have them, just comment on this video, and we'll do our best to respond. Thank you.